Good afternoon and welcome, everyone. I'm calling to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee. I'm joined today by council members Lisa Bender, Elizabeth Glidden, and Alondra Cano. We're a quorum of the committee. I expect council member Andrew Johnson to be arriving soon. Jacob Fry, I'm not expecting to arrive. He'll be absent today. We have 4 items on our agenda today. 2 of them are consent items. One of them is a discussion item and the other one is a public hearing. I think I'm just going to move our 2 consent items first, and then we'll go to the public hearing on our tobacco sales ordinance, which is why I think most of the people are here. The consent items, one is from Animal Care and Control, which is receiving and filing a report on the appointments made by the Department of Regulatory Services to our Animal Care and Control Board. And the other consent items is setting a public hearing for August 7th to consider subject matter of amending our code related to health and sanitation, garbage and refuse, amending regulations for the use of carryout bags. Any discussion on those items? Seeing none, then all those in favor say aye. Aye. Any opposed say no. Those motions carry. Then we'll move to our first item on the agenda, which is our tobacco sales ordinance. We're going to have a presentation on that, and then we'll go to the public hearing. I think the presentation will be 15 to 20 minutes, and then we'll have the public hearing, and I'll talk a little bit more about the public hearing. But if people are interested in speaking at the public hearing, the best thing to do is to sign up with the clerk's office, but actually there's a sign-up table out in the hall. So if you haven't signed up already and you'd like to speak on that, I encourage you to sign up there first. After we go through all the sign-ups, there'll be another opportunity if people haven't spoken potentially to speak as well. But now for our presentation, I think we're going to have our Commissioner of Health, Gretchen Musicant, come up and introduce the ordinance and speak about it, and with whatever staff or others she'd like to include in the presentation. Welcome.
Yes, thank you, Mr. Chair, members of the committee. So I am here today to talk about the proposed amendment to our tobacco ordinance related to the sale of tobacco products, flavored tobacco products. I'd like to acknowledge Laura Pratt, who's standing next to me, Deanna Pennington, and Patty Bowler, all of whom have been very helpful in getting us to this point today. So I just want to take a moment and talk about the fact that tobacco is still a leading public health problem. Sometimes we get into the details of an ordinance and we might forget why are we working so hard on an issue like this. It is the leading cause of premature and preventable death in the United States. And in Minnesota alone, in a year, over 6,000 people's deaths are directly attributed to smoking. And we also know that the use of tobacco is really one of the drivers behind health disparities. African Americans have 30 to 36% more likelihood of dying from lung cancer and 53% more likelihood of dying from heart disease than white people, and we know that those diseases are highly connected to tobacco use. American Indians have the highest smoking rates and the highest chronic disease rates. Again, there's a connection. We also know that there are higher smoking rates among people with low income and low education. In fact, there's a 40% smoking rate among people with a high school equivalency compared to 15% for the general public. This map of Minneapolis shows these very patterns. This is a map of smoking amongst adults who are over 18. And you can see that the high rates are in parts of our community where we have the highest rates of people of color and people living in poverty. So there's a high correlation here in Minneapolis as well. One of our main populations that we're thinking about today is youth. And so this graph shows us that for the state of Minnesota, there are almost a quarter of our youth have used tobacco in the last 30 days, and 40% have tried tobacco products. Well, this is not Minneapolis specific data because it's based on the Minnesota Student Survey, and that is not robustly administered in our public schools. We believe that it's representative of Minneapolis, if not even more so in Minneapolis, higher rates because of the association between those communities with high poverty. Menthol in particular is a harmful substance. We know that it makes tobacco products more palatable to young people, and so increases initiation. So it increases the likelihood of starting to use tobacco products. It's also more addictive once you use it because it increases nicotine absorption. And finally, it reduces the likelihood of successfully quitting smoking. Nearly half of Minnesota high school students who smoke use menthol. This has not always been true. It has more than doubled since the year 2000. In the year 2000, it was about a quarter, or 1 in 5, so 20%, and now it's nearly half. As you can see from this graph, menthol is particularly popular amongst African Americans. We have a guest here who will be following me, Dr. Phil Gardner, and he is co-chair of the African American Tobacco Control Leadership Council, and he'll talk a little bit more about some of the practices to target this population. So nationally, there has been interest in flavored tobacco and menthol. In 2009, the Federal Family Smoking Prevention and Control Act banned flavored cigarettes, but it did exempt menthol. But as part of that action, they charged the Food and Drug Administration with studying the public health impacts of menthol cigarettes. And so in 2011 and 2013, there were 2 reports, and I'll quote from them. In 2011, they found that removing menthol cigarettes from the marketplace would benefit public health. And in 2013, they found that menthol is associated with youth smoking initiation and greater addiction and poses a health risk that exceeds the risk posed by non-menthol cigarettes. And yet there has been no action by the federal government since 2013. And so, in many people's minds, it's up to states and local government to take action on these findings. So one of the strategies in addressing tobacco use is preventing initiation. And one of the ways we do that is to reduce availability. Right now, menthol, mint, and wintergreen tobacco products are available in 317 stores, gas stations, and other outlets in Minneapolis, most of which children enter for other reasons. We have done, and that's important because reducing menthol's harm at initiation is important because 90% of smokers have started before the age of 18. And so if we can forestall that, we can really cut down on lifelong use of tobacco. A number of compliance checks have been done in Minneapolis, conducted by business licensing, our own business licensing, by the Food and Drug Administration, and by various community organizations. They use different sampling and methodologies, but as you can see on the right-hand side, all of them found stores that sold to underage people. So, the public health potential of reducing availability. As part of the FDA's ongoing study of menthol, reports have been submitted to them using modeling about the power of taking menthol out of circulation. So, one of those modelings resulted in finding that over a 10-year period, menthol restrictions will prevent 2.2 million people from starting to smoke. That's a national number, obviously. And also an assumption that 10% of menthol smokers would quit because of restrictions, and this would result in 4,000 deaths being prevented nationwide over a period of 10 years. Over a period of 40 years, it would be 100,000 African American deaths that would be prevented. So, many other communities are thinking about their responsibilities related to menthol, just as we are. I recently returned from a meeting with the Big Cities Health Coalition, of which Minneapolis is a member, and we had an opportunity to talk about hot topics over lunch, and so I raised the issue of menthol and tobacco, and there were many of my counterparts in the room that had either passed something already or were in the process of considering it. We know that last week, the City Council in Oakland, California, passed an outright ban, which is much more extreme than what we're proposing here, on the sale of menthol products, and San Francisco has done the same thing. St. Paul is considering a similar amendment to ours, to its flavored tobacco ordinance in the near future. There are 6 cities and 2 counties which have passed some kind of restriction on menthol and tobacco. So just a walk through the recent past with you in terms of your actions and our collective work on tobacco and flavoring. So in 2015, Minneapolis passed our flavored and price ordinance, but we did exempt menthol, mint, and wintergreen products. In the process of considering that, we heard from a number of community members who pointed out that that exemption was problematic to them and that we would need to come back and consider it together. And so we are here today. In 2016 and 17, a number of actions have occurred that lead us to a place where we are considering this ordinance today. The state set aside some funding for a menthol use study. Hennepin County was the recipient and has worked with cities inside of the county and has worked with the African American Leadership Forum that I'm sure you will hear from during the public testimony. And they have been doing a study of use and other patterns within our communities. Also, the Menthol Coalition was formed. 49 organizations have joined that coalition. And then in March of this year, you heard a presentation from several of the groups that have been part of this community organizing. So just a brief description of what's before us today. The amendment would limit the sale of flavored tobacco products, including menthol, mint, and wintergreen, to tobacco product shops. What this does is limit the sale to tobacco product shops, of which there are 25 today. What it does not do is important as well. I think there are some misunderstandings that you may hear. It does not remove unflavored cigarettes and unflavored tobacco products from the stores. It does not ban the sale of menthol products in Minneapolis. And it does not criminalize the use of menthol products. Its effective date, it'll be effective immediately, but enforced in 2018, and I understand there's a staff direction setting that at a specific date in 2018. Should I say the date, Mr. Chair?
You can.
Yes?
Yeah.
Okay, August of 2018. And the health department will create a list of non-menthol products to help stores understand which of their products would be covered by this ordinance. The enforcement will be the same as today, with annual license inspections and inspections upon complaints. The fines will be the same as today, with a $200 administrative citation for first offenses, doubling thereafter, possibilities of misdemeanor criminal prosecution, and potential license suspension, revocation, and non-renewal if there are repeat offenses. That concludes my comments. I would like to turn it over to Dr. Gardner, who is co-chair of the African American Tobacco Control Leadership Council, unless you have any comments or questions for me.
I don't see any questions right now.
Okay, thank you.
Thank you, Gretchen. Good afternoon, everyone. I'm Phil Gardner. I'm with the African American Tobacco Control Leadership Council. I'm also work at the University of California Office of the President Tobacco Control Leadership Tobacco-Related Disease Research Program. I've done that for the last 20 years. Let me just suggest that I want to thank the board of the City Council for taking this up. You have a great opportunity to redress a glaring social injustice that we have before us. You might look at it this way. In 1953, African Americans smoked approximately, those who were smokers, 5% of them smoked menthol cigarettes. By 1968, that had tripled. By 1976, that had tripled again. By the middle 2000s, last 10 years ago, it was in the neighborhood of over 80%. Today, what we're talking about is 85% of African Americans who smoke menthol cigarettes. For youth, this figure is even 95%. We have data on this, articles are published on this. I'm sorry I didn't bring slides. My slides are much longer, and I know we need to kind of cut to the chase. Punchline is that this phenomena that went on for the last 50 years has led to African Americans dying disproportionately from tobacco-related diseases compared to their other counterparts. Greater lung cancer rates, as Gretchen has pointed out, greater heart disease, greater cerebrovascular, stroke disease. And the punchline here is that the predatory marketing of the tobacco industry toward these products. We have data, articles published that show that there are more advertisements of these products in African American communities. There are more promotions of these products. And I guess what frankly pisses me off the most is that menthol products are cheaper. We have data from Boston, we have data from California, and even looking at a nationwide retail survey, we find this to be the case. It's already been mentioned that these are harder to quit because you take in more nicotine, mask the harsh taste of the tobacco itself, and essentially serves as an anesthetic. It soothes the throat as you take down the poisons. I would like to say, and I think many of you are aware of this, that this is not just an African American issue. It's already been pointed out, and frankly, most youth start using flavored and menthol tobacco products. There's just decades of data on that, unfortunately. Sometimes not understood that the majority of menthol smokers are women and have been women. There's a disproportionate use of this in the LGBTQ community, the Puerto Rican community, the Latino community, Native Hawaiians. In fact, I've spoken to Native at the Hawaiian, their tobacco control conference this last fall. Their figures look just like the African American figures in terms of prevalence of smoking. This is true for Filipinos, and it's true for folks with behavioral health issues, sometimes called mental illness. All of these groups disproportionately smoke menthol cigarettes. While it has been pointed out that cigarette smoking has gone down, and this is attributable to the tobacco control movement that we have in the United States, in the decade between 2005 and 2015, the only type of cigarette that has gone up is menthol cigarettes. We have data on this, recent article published in 2015. It's gone up for all age groups, it's gone up for all ethnic groups, and it's gone up across the board while cigarette smoking tends to go down. The other thing that is going up is electronic cigarettes, and the majority of them, folks that are using them, are using the e-juices that are flavored. You're going to hear a lot of arguments today about unintended consequences of restricting the sale. Let me just say this before I go on. Oakland's law, and I testified there too, it's the same as your law. It's calling for the restriction of menthol products to tobacco-only shops, period, and with a year grace period also. So it's almost essential. I don't know if the lawyers have talked to each other. It's San Francisco where they have the citywide ban. We'll kind of end with that. So there's no the unintended consequences. You might look at it this way. What are the intended consequences of smoking? The intended consequences are people get sick and die. That's what's intended. The idea that you're going to be pulled over and arrested for possession of a menthol cigarette, which is promoted by the tobacco industry, is just it's a falsehood. This is about sales, not possession. Black market is going to develop. Well, we have proof here in Minneapolis that there's been a flavors, restriction in for the last 2 years. There's no black market that has developed. There's no data about this anywhere. Lastly, the term using a ban, and this is an important distinction, you can still buy menthol cigarettes in tobacco shops. There's no ban here. So all these arguments are just frankly fallacious. Look at it this way. What we're talking about is the disproportionate marketing of candy-flavored poison to African Americans and other socially oppressed groups that is outright discriminatory and at times genocidal. This is the thing that we have to deal with. And while I have some feelings for the retailers that are not only in this room but around the country, we have to find new ways and new products to sell. And yes, it will initially hurt you, but in the long run, it will save lives, and that's what this is about. There is a growing national, that's my phone. Just push decline. Thank you. Excuse me. There's a growing, I'm about to conclude. There's a growing national movement around this. It's already been pointed out that Oakland passed this law last week. Also on the same day last week, Contra Costa County installed a 1,000-foot barrier around schools, libraries, and parks in the unincorporated areas that prohibited the sale of flavored menthol tobacco products. There's discussions going on in New York. There's discussions going on in Texas. There's discussions going on in Los Angeles. I want to encourage the city council to find a way forward on this. We would like, don't believe the hype. The tobacco industry would like you to believe that these things are cool and refreshing and it's your choice. Conversely, I would suggest to you that menthol and other flavors essentially allow the poisons to go down easier. Thank you for your time.
Thank you very much. I don't see that there's any committee comments or questions at this time. So I appreciate all the information. And then I think we're ready to move into the public hearing. There's, I think, close to 70 people who've already signed up. We're going to restrict speaking time, and we have a timer over there to 2 minutes each. So please try to keep your comments under 2 minutes. You can be less than 2 minutes, and that's fine. I'm going to try to alternate speakers who've noted whether they're supportive of the ordinance change or against it. So we'll hear from both sides throughout our time. And if there's comments that have been made that you're very supportive of, you can refer back to those comments, and you don't necessarily have to restate everything. I've got some concern that there'll be a time crunch with committee members. I know that at least one committee member has an appointment she'll have to leave for, I'm sure before the public hearing is over. It takes 4 of us to hold a quorum. Even if we don't have quorum, though, we will definitely complete our public hearing. We'll just have to defer the vote. But I'm very hopeful we'll maintain our quorum so that we can finish our business here today. So don't get me wrong, committee members. I also did want to note that there is a staff direction that I'll be moving in case people wanted the opportunity to comment on that. The health commissioner alluded to it. There's copies over there. I'll just read it so people can all hear it. This is directing the licensing department to begin enforcement of the menthol, mint, and wintergreen sections of this ordinance no earlier than August 1, 2018. So that's a full 12 months. Further directing the city coordinator's office's small business support team to work with the community planning and economic development department's economic policy and development division and the Minneapolis Health Department to support convenience stores and corner stores in making a successful transition to complying with the new provisions in the code. So that's essentially asking our staff to make sure that we do whatever we can to make sure that the transition is successful for our businesses that may be impacted. So with that, I'll open the public hearing, and the first speaker is Hassan Warsami, and the second speaker is Juan Jackson, so that Juan can get ready. Is Hassan here? Welcome.
Good afternoon, Chairman. My name is Hassan Warsami, as you can see that. I've been running business for the last 20 years in Minneapolis, Minnesota. I'm opposing this ban will hurt small business like my own. This will lead to either higher price or job loss. The revenue loss will impact the whole community and lead to minority business owners lose their business. Out of respect, business owners should at least do any economic impact started to see the harm this would cause. the Minnesota Council Chamber, who support this ordinary, need to stop telling the Minneapolis adult resident, include them African American community, what legal product they can buy. What they can buy is all adults, as you know, they have a right to buy any product that they want. We don't have to differentiate who's African American, who's the other group of people. But in a position today, some of the people are saying the African American is smoking menthols. I've been doing 20 years, over close to 20 years, 19 years now. I am been selling the tobacco. My convenience store selling that. I haven't seen any much different. Whoever smokes, either a minority or majority, whatever you can call it. African American is similar to who is adult, have a right to buy what they want to buy. I have a customer 90 years, 80 years, smoking cigarettes since they were young adults. They don't have today what they call cancer or anything else. Is you can get cancer tomorrow without smoking cigarette. You can. So this, my whole point is this. I'm banning menthol cigarette, saying that is targeting certain community of the community are completely wrong.
All right, thank you.
Thank you very much.
Next speaker is Juan Jackson, followed by Ahmed Hawani.
Good afternoon. I am Juan Jackson, and I strongly support this ordinance to restrict the sale of tobacco products, menthol flavored tobacco products, to adult-only establishments. I have worked for 30 years in tobacco control. I am the current board chair of North Point Health and Wellness Center. I am also on the board of the National African American Tobacco Prevention Network and have been for about 8 years. And in public health, we have had a movement in our community, in our local community. I've lived in 55411 all my life. And for 30 years, we've been working to fight and restrict the sale of tobacco products, particularly to youth, African American youth, and LGBTQ youth. Although your leadership is well appreciated that you would be the first to restrict the sale so in Minnesota, as you have heard, you are not alone. And so we would appreciate your support, and thank you.
Thank you very much. Ahmed Hawani, followed by Dr. Kent Kephart.
I assume it's mine because the mispronunciation, but I'll
Okay, sorry about that.
No problem.
You might want to correct my pronunciation so I get it right.
Yes, sir. Good afternoon. My name is Ahmad Al-Hawari. I own a business in the north side of Minneapolis, which it's an Hawwari. The time is. I do own a business in the north side, and I'm also, I work with the United Chamber of Commerce, which is a group of almost 155 small minority business owned. The majority or the vast majority of them are in North Minneapolis. There is no doubt that we all agree that tobacco is very bad, and I feel unfortunate that I have to stand in front of you today to oppose such a ordinance. But my concern with this ban will be the immediate and the harmful financial loss we will experience, giving us no time to prepare and develop a new business plan if there is any exist. In North Minneapolis, tobacco sales makes up at least 50% of our sales, and nearly 80% of those sales come from the menthol cigarette sales. We invested in our small community, especially in the north side, where nobody else did. Many of the stores carry groceries items like eggs, fresh fruit, and some of the stores are the only place with our customer to go shop. We keep in mind that 55% of the residents in the north side depend on public transportation. This ban is not good for our community, and keeping my store is only good. Customers not only buying cigarettes, when they go in the stores, they buy the pop, the chips, and the candy. We are banning the sale of this legal menthol product by licensed law-abiding retailers will only drive the sales to the criminal. Our ground, we're going to be seeing people buying or selling cigarettes in front of our parking lot when there's nobody to do something about it. Once again, we are selling a legal product that is purchased by adults. The city of Minneapolis is at 97 compliance with the underage person. Shifting the sale from one entity to another will not solve the problem. We do need to work together to address this problem so we can avoid the layoff and the store closing. There is not even a single smoke shop in the north side. I'll just move forward.
Can you wrap it up?
Tobacco display bans are in places in several countries in the world, including Canada, Russia, Iceland, Norway, Russia, and Australia, where they mandate that shops and stores that sells tobacco products keep the products out of sight of customer under the counter or in a special cabinet. Tobacco products can only be shown or requested by the customer. We will see a decrease in the sale, but will be better than shutting down the operation completely. Nobody wants to see a business close down and an employee laid off.
All right.
Thank you.
Thank you very much. And if you have additional comments that are written, you can certainly turn them into the clerk and we can copy them. Now it's Ken Kephart and then Mahad Wadi.
Thank you. I'm here to support the proposed change in the ordinance to restrict, not ban, menthol smoking to tobacco-only shops. I've lived in Ward 3 for 15 years. I won't repeat some of the medical information. You already know it. I will say that I'm also here today. I have 12 grandchildren. Their ages are 13 to 2. And I hope I'll never get addicted. I do geriatric care. I've seen the results of long-time smoking. It's clear that menthol products help people get addicted. It's clear that teenage brains are very susceptible to addictive agents, including nicotine and alcohol. Easiest way to quit smoking is to never start. Limiting youth exposure will help them never start. I think I'll end with just saying there's a good letter today, letter to the editor from a former colleague of yours, Natalie Johnson Lee. She says, cigarettes are not food, they're not medicine. They are as addictive as heroin. They are highly engineered drug delivery devices that, when used as directed, cause harm and possible death. She goes on to point out, as has been mentioned already, that the Afro-American community is disproportionately affected by health problems. So I hope you'll make the right decision today. Thank you.
Thank you very much. And I believe Natalie Johnson Lee was here today, and I don't know if she's in the room right now, but there she is. Yep, glad to have you here. You were just quoted. Okay, now I'm not sure how I did on. Is there a Mohammed Wadi?
Mr. Wadi had to leave. He had an emergency.
Okay. Is there Abdil Al-Basad?
Hello, everybody. My name is Adil Al-Basad. I own 2 businesses in North Minneapolis, and this cigarette thing is going to impact us a lot. Almost 70% from my sale is menthol cigarette, and we just invest a lot of money actually in Northside. We just built a brand new building in Northside worth by $1.3 million, and we just doing remodeling to the second building, and it costs about $350 now. We need your help to stay in the business. Thank you.
Thank you very much. Is Sylvia Amos here, and then followed by Ken Aldwalk?
Good afternoon, members of the Minneapolis City Council. My name is Sylvia Amos, and I live at 1918 Thomas Avenue North. I serve as president of the Women's Auxiliary of the Minnesota State Baptist Convention. I've spent the last 2 years educating members of Stair Step Foundation, His Works United, a community-wide collaboration of African American churches in the Twin Cities, on the harmful effects of menthol tobacco. My mother, a well-known leader in this community, started to smoke at the age of 11. She was addicted to Benson & Hedges menthol cigarettes and died in 2003 at the age of 71 from lung cancer, which was a direct result of her years of smoking menthol. Last year, several churches were involved in the No Menthol Sunday, where pastors across the country dedicate one Sunday in a year to educating their congregations about menthol. Last year, 10 pastors delivered sermons about menthol, and this year we had 16 churches get involved in delivering the message on menthol. Our focus has primarily been on youth, protecting them from ever starting to smoke, but we need your help because we cannot do this on our own. Restricting menthol tobacco products to adult-only stores will help prevent our youth from ever wanting to use these products. Keeping youth from purchasing these products is a good thing, but keeping them from ever being lured into trying them is an even better and responsible thing to do. I support this ordinance because it will help today's youth and young people not suffer as my mother did. For me, it is simply a support of life or death. And I support life, and I hope you will too. I thank you.
Thank you. We have Kevin Aldwalk, followed by Carolyn Best.
Good afternoon. I'm honestly confused at this point why we're introducing this ordinance. I thought the purpose of this is prevention to underage and youth access and to exposure, define exposure. This product with pictures and images is available online. It's available in YouTube videos. It's available in movies. It's in cinema halls. What are you trying to accomplish? We're your first line of defense here as retailers. We just scored 97% as retailers for compliance rates. We're first line of defense to prevent youth access to this product. You ban it in our stores without having a strategy to address it in nearby cities or on the street. There goes your compliance. There goes your control to access. I'm not here to lobby for tobacco. We all know tobacco is bad. We do our best to prevent youth from accessing it. This is an illegal product. If it's not going to be banned on statewide, or why not ban the whole cigarette product in all? Why just menthol? I sympathize with the African American sentiment that this is a gateway to smoking. They have larger issues, high blood pressure. They're not addressing it, where they could address their diets, needs, stuff like that. Why attack a legal product? We already do control and follow government regulations with restriction. If you're worried about your youth from smoking, don't expose them, educate them. I'm not going to become his parent too at my business. Thank you very much. I strongly urge you to vote no against this ordinance.
Thank you very much, Carolyn Best.
Yes.
And next is.
Good afternoon. My name is Carolyn Best, and I live at 5910 65th Avenue North. And I am a two-time cancer survivor. I thank you for this opportunity to speak in support of this ordinance to restrict the menthol tobacco products to adult-only tobacco shops. I recognize that the tobacco industry has targeted our young people, and I recognize that from my neighborhood. It is working. Here in Minnesota, the menthol products are being used by our youth has not decreased but increased. We know that African Americans, we have a high risk of suffering from tobacco products and those diseases that follow, high blood pressure, all of that can be contributed to the use of tobacco. I'm a mother of 6. I have 15 grandchildren, a host of nieces and nephews and cousins. And I know that flavored tobacco will entice them to start smoking. This city council has took the first steps to restrict this candy and fruit flavored tobaccos from our children's eyesight. If they don't see it, they won't be able to entice themselves to start it. But if it's put in their presence, right in front of them at their eye level, they are sure to be inquisitive about starting it. So now it's time for the city council to not only talk about the use of tobacco, but the restriction of menthol in our neighborhoods. I'd like to thank you again for listening to my testimony. And I'm really heartfelt about our young people of today. Thank you.
Thank you very much. Next up will be Madalzwa Morgan, followed by Gabriel Glissmeyer. Hopefully I didn't destroy your name too much there.
That's okay. My name is Madalena Morgan, and I'm here with Bobby and Steve Zotterwell, and we're opposing this ordinance. Getting a little bit away from the script here, we all know that tobacco is bad. I'm a mother of two. I don't want my kids smoking, but it's about education and how you really parent your children. I bring my kids to work with me when they don't have daycare. Not once my 13-year-old ever questioned about cigarettes. It's always about the candy bars, which I'm forced to buy for him when I'm there. If this goes through, we will have a major blow into our bottom line. But that's not what we're concerned about, is because it's not just about the menthol sales. Is that add-ons that we also going to lose with candy bars, drinks, fuel, because we're not making this all Minnesota. So we're opening for people to go to the neighborhood cities and being able to make their purchases there. I'm very involved in the industry, and I've heard a number that shocked me, that 35% of tobacco consumption in Minnesota is underground already because of how high our prices are. And when we talk about that, there's no numbers about what the flavored tobacco, we might not have that, but this total tobacco, we know there's a lot of underground purchases being made because of how high our is. We also have been running this business model for decades, and even though it's a category that's slowing down, it's still our number one category, and that's what drives traffic to our stores. And if this should go into effect, we're just asking for time to think about how to shift our business model. And a year is not enough. And we're open to conversations. We're just asking for time to look into what we can do for our location so we don't have to close doors. Thank you.
Thank you very much. And is Gabriel here? The next speaker after Gabriel will be Mabej Abu Sarah.
Hello, my name is Gabriel Glissmeyer. I live at 301 5th Street Southeast. I am here to express my support for the proposed ordinance to restrict the sale of menthol tobacco to adult-only tobacco stores. According to Rainbow Health Initiative's 2016 Voices of Health survey, which kind of does a snapshot of the health of LGBTQ Minnesotans, 44% of LGBTQ people of color who are smokers prefer menthol, and 70% of LGBTQ youth smokers also smoke menthol. This comes as no surprise, as tobacco companies have spent millions of dollars pushing menthol products in our communities to make us lifelong customers. I urge you to vote in favor of this ordinance to protect the health of communities targeted by the tobacco industry. Thank you.
Thank you very much. Paul Pentel will be the next speaker. Welcome.
Good afternoon. My name is Majid. I am an owner of a business in North Minneapolis. First of all, I would like to say that I am a father. I have 4 children. I don't want them to be near tobacco. We all agree that tobacco is bad for everybody, and it's the cause of many diseases that we don't want to be associated with. But we have to look at the impact in North Minneapolis and South Minneapolis on stores like mine. Let me talk about my store, for example. I've been in my store for 20 years. For the 20 years, we've been in compliance of not selling to minors for 20 years. And by putting the ban on menthol, basically you are punishing us because we follow the law. Second, in my statistics in my store, 82% of my cigarette sales are menthol. And around 50% of my sales are tobacco. If I take that out, basically 40% of my business is going to be gone away. I employ 3 employees other than me. Basically, if this go in effect, I have to go to drastic measures and fire 2 or 3 of the employees and work myself if I don't close down, period. I just want to note here again one more point, that by doing the ban, we are creating a black market for cigarettes. People will sell cigarettes in their houses in order to get access to the cigarettes. One more point. We are not telling the customers, especially over 18, you are not allowed to smoke. No, we're telling them you are allowed to smoke, but you cannot buy your smoke from my store, which is a base for discrimination. I urge everybody to vote against this amendment, and thank you for your time.
Thank you very much. Is Paul Pentel here? Then the next speaker will be Dwight Allen. Welcome.
Chair Gordon, council members, I'm Paul Pentel. I live at 225 Upton Avenue South. I'm an internist and director of the Tobacco Dependence Clinic at Hennepin County Medical Center. I'm also a member of the Minneapolis Public Health Advisory Committee, which unanimously supports the proposed amendments. I want to focus on why the specific strategy set out by the proposed amendment is important. The sale of tobacco products to minors is already prohibited, so why do we need further restrictions? What can we expect to accomplish? The answer is that this amendment isn't about ability to purchase, it's about messaging. It's about the tobacco industry's efforts to create a market for menthol cigarettes, the most addictive tobacco products available, and then to position them as starter products for children. Nearly 90% of smokers start before the age of 18, so we know that kids can get tobacco products if they want to. The issue at hand is what tobacco product are they going to choose? Kids see ads every day online and magazines and stores reminding them that menthol cools smoke, makes it less harsh, easier to inhale, has a better flavor. Features that are deliberately engineered into cigarettes to make them attractive to new smokers and to make them more palatable. Every display of menthol products in a store is a reminder of this message. Reducing exposure to these messages will reduce the number of kids who try menthol products and will reduce the number who make the transition from first cigarette to becoming a regular smoker. Council members, I work with smokers every day who are trying to quit. Every one of them wishes they had never started. Thank you.
Thank you very much. Dwight Allen, and followed by Martha Hewitt. Say that. Okay. Is Martha Hewitt here? You could go ahead. Oops. Welcome.
Members of council, my name is Martha Hewitt and I live at 5124 Vincent Avenue South in Ward 13. I'm here to support the proposed ordinance. I'm a retired researcher and my work included indoor air quality and specifically secondhand smoke. And I've also had several close relatives who've died of tobacco-related diseases, including lung cancer and COPD. There is abundant research that shows that menthol makes it easier to start smoking by masking the harshness and irritation of tobacco smoke. It makes it harder to quit. For the reason that it makes it easier to start, the tobacco industry specifically target markets menthol to youth as well as to African Americans, to my own LGBTQ community, and the groups that use menthol at higher rates also have a higher incidence of smoking-related disease. So I would really like to see Minneapolis take the lead in reducing youth access to menthol tobacco. So I hope you'll vote yes, and thank you.
Thank you very much. Is Dwight Allen here now? How about Aswar Akman?
All right. Good afternoon, council members. My name is Azar Rahman. I live at 2700 Humboldt Avenue South. And the members of the council, I have friends and family who smoke cigarettes, and I hate it. I think it's a disgusting habit. I think it's very expensive. I think it's disastrous to your health. So, and I think I agree with everyone in the room, no one here wants children to start smoking. That should not be the question here. No one, not a single person in this room wants children to start smoking. What I disagree with is this strategy we're taking towards actually reducing smoking, because we know this. We know that this will not actually reduce usage, because no one lives more than a mile or two away from a suburb that has a store that will provide much easier access to the same product. So in that way, this will not be effective in terms of limiting access for adult age smokers. For underage smoking, we are actually making enemies where we should be making allies. These convenience stores, these corner stores that are currently selling these products, they are oftentimes the best enforcers of the laws that are on the books. They're the ones who make sure that they deter children away from smoking until they turn 18. And now what we're doing is we're pushing it out onto the street, and somebody peddling a menthol cigarette on the street has no incentive or reason to ask for an ID. And we know that this will almost exclusively punish black smokers. And here's the thing, we heard somebody say that there isn't an adult-only store in North Minneapolis. So when we talk about this not technically being a ban, it is a ban for North Minneapolis. And we are punishing adult smokers who have made the choice to smoke, which I, again, personally, don't think is a good health choice. Now, what we need to do in Minneapolis, we need to invest in education on these things. I mean, just pushing it onto the street is not going to help anyone. And when we talk about education as the route forward, our city has to work with small businesses and create a truly effective program to reduce smoking in our city. And that should not be based on rhetoric. It should be based on information and awareness. And we should make sure that we aren't punishing the stores that can be the biggest resources in making sure we actually cut back on underage smoking in our city. And we should focus on real results rather than, symbolic moves which do far more harm than good in the long run. And that's my request as a small business owner myself, and web and media, not having anything to do with tobacco, but as a small business owner from family of Minneapolis small business owners, work with the small business community instead of talking down to it. And please don't pass legislation like this, and make sure you don't make decisions about us without us.
Thank you very much. Is Alexandria Pedersen Green here? And then we'll see if Dwight Allen is here as well. Might be his last call. Welcome.
Good afternoon. My name is Alexandra Pearson Green, and I live in Ward 5, and I am a hospice nurse. Unfortunately, in my job, I often see the stages of a lifetime of addiction to tobacco. I see people in pain and struggling just to breathe. I've seen people choose between wearing oxygen and giving into their addiction by having one more cigarette. I don't want to see a new generation of young people addicted to tobacco. I don't want anyone to have to go through the suffering at the end of the lifetime of addiction the addiction has caused. This is why I support this ordinance, because we need to put the health of our residents over profits. Thank you.
Thank you very much. Is Maddie Disa here?
Hello.
Welcome.
I'm Maddie Dibble. I'm a student at the U of M in Councilman Gordon's Ward 2. I'm here because I believe that this ban is an infringement on the rights of adults in this city. I believe that this is a matter of personal responsibility for people to take their health into their own hands. At the beginning of the presentation earlier in this hearing, there was a lot of discussion about what this ban doesn't do. But what I believe all of those statements should have been followed by was the word yet. It doesn't include standard cigarettes yet. It doesn't ban all tobacco yet. And it also doesn't talk about where this infringement on our health stops. Does it stop with tobacco, or does it continue on with junk food? I don't believe it will stop. The least we can do at this point is do the proper research to see the consequences of this action as a whole. Thank you.
Thank you very much. Is Vivian Jenkins Nelson? And then next there's Cindy Awajani. Welcome.
Thank you. Good afternoon. My name is Vivian Jenkins Nelson, and I live at 1025 Thomas Avenue North. I am a senior fellow and director of the Interrace Institute at Augsburg College. I am also board chair at the tobacco prevention nonprofit Clearway, Minnesota. Regarding the proposal before you, I say it's about time.
It's about time that our policymakers and community leaders understand how the cigarette companies and sellers of cigarettes prey on African Americans. It's about time that we ask, why is it that 88% of Black smokers smoke menthols compared to only 26% of white smokers? It's about time that we all realize the tobacco industry has done this to us and done it on purpose. It started in 1612 when America had its first cash crop, tobacco, well before cotton. Our African ancestors were first brought here to grow and pick tobacco. Tobacco enslaved us. 400 years later, we're still enslaved to tobacco. I've been around long enough to remember how tobacco companies handed out free menthol cigarettes in our neighborhoods. Menthol, clean, tasty, easy to smoke. The companies were everybody's friend. So what has this friendship gotten us? Addiction and death, and it has to stop. African American children and adults are more likely to be exposed to secondhand smoke than any other racial or ethnic group. Smoking kills us more than accidents, homicides, and it's got to stop. I am proud to live in Minneapolis, a city that is saying yes, it has got to stop. I ask that you start the stop today. Please vote to adopt the menthol restrictions. I thank you.
Thank you very much. Is Cindy Awajani here? And then the next speaker is Stella Whitney West.
Hello, my name is Cindy Awajan. My husband and I own 3 retail shops in Minneapolis. We're here today to protect our livelihood, basically, and we sell a legal product. I believe the people in the green shirts today probably are against cigarettes in general, which I think we all are. But that's a different reason than what we're here for today. Today, about the menthol cigarettes. So we would bring the legal people who use menthol and minors who try to use menthol illegally into tobacco shops to be exposed to the crack pipes, bongs, and other paraphernalia that they carry. Instead of into a store where they'll be exposed to groceries, sodas, and snacks. All minors who would be going into tobacco shops with their menthol smoking parents will also be exposed to these drug paraphernalia, sex toys, etc. Asking their parents, "What is this, Mama? What is that?" instead of saying, "Could I have a sucker today?" You say that the menthol is targeting the Black community, where I can quote my Black customers who feel like you're targeting the Black community to make them go to special stores to get these products, while the white man's cigarette is still available in all the stores. And that's a quote from a customer. So they wonder why you're attaching race to that. You're taking legal products that we have a license to sell and giving all that business to another business down the block. You will literally put small business owners out of business and put tobacco shops making millions. You'll bring more people into their business to expose them to these paraphernalias to use illegal products with. I often run the register at our store and I see who buy the menthol cigarettes. They're the Black, white, Asian, Hispanic, American Indian, and we're all one. We're all human. We do not sell to minors. If people want to smoke menthol cigarettes, putting them in a tobacco shop is not going to stop them. It will create a street market for those products being sold out of backpacks, especially in areas where there's no tobacco shops or that after the hours the tobacco shops are allowed to be open. Why not have suppliers change their packaging instead of playing favorites? I feel it's playing favorites to a certain type of business, the tobacco shops, rather than our business, and it makes me wonder who has special interest in those tobacco shops. So thank you for your time.
Thank you for yours. Stella Whitney West.
Thank you, Mr. Chair, members of the City Council. Thank you very much. My name is Stella Whitney West, and I'm the CEO of North Point Health and Wellness Center. We are a federally qualified health center located in North Minneapolis, and we are in partnership with Hennepin County. Through our health center, we serve over 25,500 patients annually, over 100,000 visits. So I think we can speak about what is happening in North Minneapolis. Our mission is partnering to create a healthier community. And I encourage you to look around, those in the green shirts, those who are talking about beautiful lies, ugly truth. This is what partnering looks like. I am proud to say that North Point has been a leader in this effort to put flavored tobacco products into adult-only tobacco stores, not adult-only stores, but tobacco stores. We led that effort for a very simple reason with our young people at the front, is that young people are attracted to tobacco use because of the flavors. And menthol, as you have heard, is the largest and most addictive flavoring of all. So you've already heard the data, but there's one of the things that I want you to be aware of, and that is that within the African American community and in the leadership within the African American community, we are very clear. We are united on this issue. I want to make sure that you understand that we are united on this issue. We are also very aware of how people will use different tactics to make it appear as though there is a division. There is not. I also want you to be aware of the healthcare debate that is occurring in Washington, D.C. Keep in mind, while the debate is mainly focused on coverage for the treatment of disease, I want you to keep in mind what we would lose in terms of access to prevention and education. We also want you to keep in mind the high cost of disease caused by tobacco products. And I would dare say that that cost outweighs any lost profits. I also want to say that North Point is extremely proud of the work that you have done and the leadership that you have done as a city council. And we encourage you to keep up the good work and to pass this ordinance. Thank you very much.
Thank you. Is there a Cindy Carganer? There, the other Cindy. And then Farhan Mohammed is next. Welcome.
Hi, my name is Cindy Kagam, and I'm actually supporting the ordinance. Was a mistake out there.
That's all right.
I'm the director of the American Heart Association for Multicultural Initiatives in the state of Minnesota. I'd like to thank you for allowing me to testify today on behalf of the American Heart Association and all our volunteers in Minneapolis. It's clear that there's an urgent need to restrict access to menthol cigarettes. It's been several years since the Tobacco Products Scientific Advisory Committee found that menthol cigarettes have an adverse impact on public health by inviting experimentation by the young, increasing the number of youth who become regular smokers, and making it harder to quit. An independent assessment by the Federal Drug Administration came to the conclusion, what more evidence do we need? Minneapolis has a great opportunity to reduce access to menthol cigarettes and to limit tobacco-only retailers and away from minors. Every day, 1,200 Americans die from tobacco-related diseases and replaced by 2 smokers under the age of 26. Menthol cigarettes are one of the many products peddled into our nation's youth with intent of addicting a new generation. Menthol cigarettes are one product that lures young people into a deadly habit and sets them on the road to hardening of arteries and coronary artery disease in adulthood. The American Heart Association urges you to vote to restrict menthol in Minneapolis tobacco-only retailers. Thank you for your time.
Thank you very much. I did call Farhan next.
Good afternoon. My name is Farhan Mahmoud, and I live at 3615 Fremont Avenue North. I am here today in support of the proposal to restrict where menthol tobacco can be sold. Menthol flavoring in tobacco makes it easier to start and harder to quit. Many people in my community smoke shisha, and mint flavor shisha is very popular with young people. The minty taste makes shisha seem less harsh and makes it easier to smoke, which means it's easier for young people to get addicted. This policy will protect young people from exposure to these appalling products and will protect future generations from harms of tobacco. I hope you will vote yes. Thank you very much.
Thank you very much. Next, I have Steve Haddon, maybe, and followed by Janelle Kozinski.
Steve what?
Steve, I can't read the last name.
Haidari?
Yeah, that sounds right.
Okay, that's me.
Starts with an H.
All right. Yeah. My sister died last year on May 23rd, and she wasn't a menthol smoker. She was a regular smoker. So I think cigarettes kills both smokers of menthol or non-menthol. I'm not gonna talk about the impact on my store and all of that because you guys know all of this. You guys know how much it's gonna make a difference in our stores and our businesses. The only thing I don't understand is what's discrimination in here? Is it like you guys want to protect minorities from the menthol and harm the non-minority, the majority? What is this? Is it like, okay, you minority, you cannot smoke what you like, and majority, you'll smoke what you like? I really don't understand this law. We all talking about minority. Why don't we give them their choice to smoke whatever they want to smoke? I sell black folks, I sell them regular cigarettes. I mean, non-menthol. And I sell white folks menthol cigarettes. So why is it minorities, and a minority? Like, are we protecting them and harming the other people? It doesn't make no sense to me. You know? Thank you.
Thank you very much. Janelle, and then followed by Sammy.
Good afternoon. My name is Janelle Koshinsky, and I live in Ward 1. I'm a proud Minneapolis resident, mother, and employee at the American Lung Association. I'm here today in support of the proposed ordinance that would restrict the sale of menthol tobacco to adult-only tobacco stores. I see how methodical the tobacco companies are about developing their advertising. Tobacco industry documents reveal how menthol-flavored tobacco has deliberately been used to attract youth for decades. As a mother, it is alarming to me that menthol cigarette use among youth has more than doubled since 2000. But you can see why. The industry needs to replace the millions of people who smoke they lose each year to tobacco-related causes. I'd like to see my city do all that it can do to help our young people lead healthy lives, free from the struggles of tobacco addiction. Thank you.
Thank you very much. And I think it's Sammy Abed.
Good evening.
Good evening.
What everybody here agree, the health issue, and try to reduce the use of the smoke. When we close one door and leave 100 doors open, are we gonna stop this problem? Are we gonna reduce the death of young kids from cancer or something like this? You're leaving 100 doors open, Robbinsdale, Brooklyn Park, everybody, like one block around, he can have an access to pack of cigarettes. And the doctor, he speak about the black market. Last year, when you guys passed the tobacco prices ordinance, I have approved. There's a lot of black market created in North Minneapolis. We have people come to our stores with business card to sell us products from black market. They told us, we come from Wisconsin. I have business cards for these people. They come from other states to sell us as a store owner product for a cheaper price. I have one customer, he's talking about selling cigarettes soon in his truck, like the ice cream truck in the north side. Is that gonna stop the problem? And when we talk about 6,000 people die from using menthol cigarettes, how many people die from using liquor? How many people die from last week? How many people die from shooting? Why we don't talk about these people? Why we don't stop these things? And instead of talking just about who use menthol cigarettes, is that going to stop the problem? Leaving 100 doors open is not going to stop this problem. Thank you.
Thank you very much. Gilbert, okay, followed by, and I can't really relate, it looks like Wijam Abed.
Hi, my name is Gilbert Ache, a 13-year resident of Minneapolis, where I live in the 9th Ward.
I work at the Center for Prevention at Blue Cross and Blue Shield of Minnesota. Earlier in 2017, we released a report which found that each year, smoking claims over 6,000 lives in Minnesota, and that it costs our state $3.19 billion to treat diseases caused by smoking. That equates to over $593 for every adult and child in our state. The number of deaths is equal to eliminating an entire small town in Minnesota. But this work also hits me personally. As a child, I remember that when my mom was low on cash and ran out of her cool 100s, she would send me with $1 to our neighbor's house to buy a single cigarette. At the time, it was a nuisance to me because I just wanted to be outside playing with the other kids. Last month, I went home to Hawaii to visit my family, which consists of the 3 groups that Dr. Gardner earlier mentioned among the many groups targeted by the tobacco industry: Filipino, Puerto Rican, and Native Hawaiian. I stayed with my mom, who still smokes those cool 100s, which she gets from the convenience store right across the street. Today, that's no longer a nuisance. It's now a serious threat to her very life. She coughs a lot, she gets sick easily, and is out of breath when she walks to her job at the elementary school a few blocks from our house. I do this work fighting for health equity, for racial equity, because it's the right work to do in our Minneapolis community and for the people in our state. But I also do it because of my mother, who, not yet 60, I worry won't be around for very much longer. So I urge the council to support this measure in favor of health and racial equity, in favor of saving lives. Thank you.
Thank you very much. Next, I believe this is Sammy. This might be your brother. Somebody, Wajami? Is there someone else from the store that came to speak with you? Okay. It's the same address. Maybe they just signed in. How about Ken McKay? And then Ken will be followed by Gene Nichols. Welcome.
Thank you. Good afternoon. I see a lot of our customers, both former and current, here today. I represent the wholesale industry that serves these customers, not just with tobacco products, but also with groceries, frozen foods, food service items, an entire catalog of 15,000 different items. What I can tell you is that these folks employ a large number of people. They take great pride in their stores. They do a lot for their community, and the difficulty that would be imposed upon them with this particular ordinance is not a good thing for them. The cost of what they would have to do in terms of trying to find additional revenue streams would be an extremely high amount of investment in something else, whether it be food service or other revenue streams. It's literally in the tens of millions of dollars that this will happen. Before we look at passing this, I think you folks need to do a real hard look at what you're attempting to do with this. I think, again, most folks have made the comment that we all know smoking is not necessarily something they should do, but going back to when I was a small child, I grew up in the distribution industry. There were Cools, there were Virginia Slims, there were Salems for decades prior to the menthols that are available today. I think restricting products to smoke shops is not the right thing to do. It's restrictive for folks. I think everybody should have an opportunity to buy a product that's legal, to buy a product that has been licensed, and it is very discriminatory against having these retailers be able to sell those products. Thank you.
Thank you very much. Is Gene Nichols? Okay.
Good afternoon, City Council. My name is Gene Nichols, and I stand before you in grief due to the death of my brother on July 4th from COPD at the age of 68. I am here on behalf of the African American Leadership Forum. We are committed to addressing the use of menthol tobacco in order to improve the health of the African Americans in Minneapolis and reducing health disparities across the state. In 2015, when you restricted fruit and candy flavored tobacco, We told you we would be back to include menthol, and we are here. The tobacco industry has targeted African Americans with menthol cigarettes for decades. In 2016, the African American Leadership Forum received a SHIP grant from the Minnesota Department of Health to educate and to research African Americans' attitudes and perceptions towards menthol. We found that 84% of African American smokers in the metro area smoked menthol tobacco, and 72% agreed that menthol makes it harder to quit. 69% of these African American smokers believe menthol makes it easier for young people to start smoking. We must do better. We must do better. You have the opportunity in front of you to help our young people of color lead healthier lives, free from the struggles of tobacco addiction. I hope you will support this important policy. Thank you for your time and your support of this ordinance.
Thank you very much. Dwight Allen is next and then Prashasti Bhatnagar.
Yeah, my name is Dwight Allen, and I'm also an African-American male that lives in South Minneapolis. And I choose to smoke cigarettes myself. My thing is, I feel like this ban would not stop people from smoking menthol tobacco. It will only create a black market for someone to sell menthol in the streets. And the underground market will make it easier for underage kids to get menthol cigarettes because no one will be checking ID. The thing is, if the problem is cigarettes, why don't we just ban cigarettes? Why just menthol? The ban will hurt local convenience stores and gas stations. Menthol is a large part of their sales. Their stores and gas stations have about a 90% rate of checking IDs and tobacco. They are not the problem. Why is the city council targeted them? That's it.
Thank you very much. Welcome.
My name is Prashasti Bhatnagar, and I'm a senior at the University of Minnesota Twin Cities, living in Minneapolis's Ward 2. I'm here representing a group of public health and medical students who strongly support this ordinance. Preventive measures like the one before you today are the most effective way to limit tobacco's toll on our communities. Take a moment to imagine what could be done with the $3 billion in excess medical costs spent every year in treating patients for tobacco-related diseases in Minnesota. That number is not a projection. It's a reality that our medical systems face day in and day out. We are proud to live in a city that consistently shows such bold leadership in public health as Minneapolis, and we hope that doesn't stop at menthol. Thank you.
Thank you. Steve Rush, and then followed by Grace Higgins. Good afternoon.
Thank you very much. Good afternoon. My name is Steve Rush. I'm the Director of Government Relations for Holiday Companies. Holiday has 13 stores in Minneapolis, employing over 200 people, and we have been doing business in the city for over 50 years. Retailers do not sell to underage individuals. The most recent FDA study found that we do have a 98% compliance rate. The business community has made a substantial investment in the city of Minneapolis. We can only continue these investments when we have certainty of a viable business model. That viability is threatened when we continue to see labor mandates, packaging bans, and restrictions on what products we can sell. Tobacco sales do constitute almost 40% of our inside sales on average per store. Menthol, wintergreen, and mint products are at least a third, and as you've heard from some of my colleagues, it's much higher for them. A ban on menthol and wintergreen and mint products would eliminate $73.5 million in annual sales in convenience stores. That amounts to a sales loss of almost $226,000 for the average convenience store. I do have a document to submit to substantiate these figures. The actual sales loss is much higher if we look at the ancillary sales we'll lose, including gas and in-store products. The actual sales loss could be well over $100 million annually. No segment of the business community can afford such sales losses. In order to understand these numbers, we request that this action be delayed until an economic study can be completed to assess two things. First, what was the effect of the 2016 flavor ban, including whether it has created an underground market? And also, secondly, what would be the ultimate economic effect of a ban on menthol, wintergreen, and mint products would be? I have two proposals by management science associates to submit for the record documenting these economic studies. MSA is a neutral third party and was chosen to administer data collection in the 1998 Master Settlement Agreement. They estimate that we can get this done in 10 weeks. We simply ask you to postpone any action until they have an opportunity to do so. Thank you very much for your time.
Thank you. Is Grace Higgins here? And then the next speaker will be, I think it's Khaled Abdel. Okay.
Hello, my
Hi.
name is Grace Higgins. I'm here today to support this ordinance on behalf of the Twin Cities Medical Society. We're an organization that represents nearly 3,000 physician members and medical students who live or practice in Minneapolis. For decades, the tobacco industry has targeted our youth, as you've heard over and over today, particularly those from marginalized communities with menthol tobacco products. They've done this because the industry knows and research has confirmed that menthol makes it easier for youth to begin smoking and increases the chances that adolescents will go on to smoke in adulthood. Our members see patients facing death and disease as a result of tobacco use every day, and are first to tell you that we must do more to protect our youth from beginning to smoke. Twin Cities Medical Society urges you to support this ordinance so today's children don't become tomorrow's patients.
Thank you very much.
Hi, my name is Kel. I have a store in South Minneapolis. I don't know why you guys making it is us against them. We're all against smoking. All what we don't understand is how come you're gonna split the convenience business into two businesses? With the increase of like minimum wage to $15 an hour within a couple of years, how are we gonna split our business like convenience store and a smoke shop next to each other? Why you wanna take it from the convenience store and give it to the smoke shop? It's still available. It's not gonna curb the smoking in Minneapolis. That's my opinion. Thanks very much.
Thank you. Monica Eischen is next.
Hi, my name is Monica Eischen, and I live at 4354 Chowan Avenue South. I retired from the Centers for Disease Control and Prevention in 2015 after 25 years serving the Centers for Disease Control's Office on Smoking and Health. At CDC, I specialized in state and local policies. I have visited and consulted with the tobacco prevention programs in all 50 states and many cities and communities and counties. I strongly support this policy to restrict sales of menthol-flavored tobacco products. We should be very clear why the tobacco industry wants to continue selling menthol-flavored tobacco products and other menthol-flavored tobacco cigarettes. First, to get young people to start smoking, and second, to keep people smoking after they start. In 2014, the U.S. Surgeon General issued a report that said, menthol in cigarettes was a design feature that produced physiological effects, including sensory effects, contributing to tobacco use, and that removal of menthol cigarettes from the marketplace would benefit public health in the United States. Menthol-flavored tobacco products contribute to the 480,000 Americans who die of smoking every year. The science is very clear that this new policy will work. As our excellent Minneapolis Health Department points out in the request for committee action document, this policy will cut the number of teens who initiate tobacco use and reduce the number of adults who continue smoking, especially among minority groups. Minneapolis and Minnesota are nationally recognized leaders in public health. Putting this policy in place will be good for Minneapolis and will encourage cities across the country to do the same. I want to congratulate council members for your leadership and courage in adopting this policy. Thank you.
Thank you very much. Next is Connie, unless it's Lonnie McQuirton. Then how about Emily Anderson?
Good afternoon, Chair Gordon, members of the City Council. My name is Emily Anderson, and I live at 4136 Columbus Avenue in Ward 8. My daughter Vivian is very upset that she couldn't be here today. Maybe she was a little bit more upset that it was nap time and she had to leave. My second little one will arrive in November. I'm here today in support of this proposed ordinance. My family and I are very proud to live in a progressive city that's willing to take on tough issues to make our community better for everyone. As city's leaders, you can prioritize the health of all Minneapolis residents by restricting the sale of menthol tobacco. The tobacco industry will not continue to thrive if young people don't start to smoke. And it's well documented that menthol makes starting easier. Restricting the sale of menthol to adult-only shops will help prevent kids, like my Vivian and my little one on the way, from ever picking up the deadly habit. And it will have a lasting impact for generations to come. There's been lots of talks about livelihood today, and I'm talking about lives. On behalf of my husband, Vivian, and our little one on the way, I thank you for your time and for your support of this ordinance.
Thank you very much. Is there a Cashlyn Cannon? How about Tatiana Morrow? Welcome. Thanks for being here.
Good afternoon. My name is Cashlyn, and I live in North Minneapolis. I have been a part of the Breathe Free North for 2 years, working to improve the health of families and communities in North Minneapolis by reducing youth access to tobacco. I am here today to tell you why I support changing how menthol is sold here in our city. When I found out that the city council was considering regulating these flavor products that are very appealing to young people, I knew that our hard work was paying off. I strongly believe that if you support the ordinance, fewer young people will become addicted to tobacco and my generation will be much healthier. Thank you for your time.
Thank you very much. And Tatiana, and next is Karma Hopewell.
Good afternoon. My name is Tatiana Morrow. I work with youth in North Minneapolis as a part of the Breathe Free North program, and I am a resident of Ward 4. I strongly support the ordinance you are considering that limits where menthol tobacco can be sold. A few months ago, Breathe Free North partnered with the city to conduct the educational youth compliance checks in North Minneapolis. Of the 40 stores that the youth group visited, 15% of those stores failed, including a Holiday Inn, a Bobby and Steve store. Even though the tobacco industry store owners claim that they don't sell tobacco to underage youth, this still is a major problem in our community. The truth is, these harmful tobacco products are in stores in North Minneapolis, and young people can get them with no hesitation. Really. I'd like to live in a community where young people never start to use tobacco. If they never start, then they never have to quit. I strongly believe that if you make this change, there will be fewer kids coming addicted to menthol tobacco. To me, that's all the reason we need. Should no amount of money be more important than the life of a young one? The life of a young one. Thank you for your time.
Thank you very much. Karma Hopewell, and then followed by Stephen Marsh.
Good afternoon, Minneapolis City Council members. My name is Karma, and I am a member of Breathe Free North. My family and I live in Ward 4. Thank you for letting me tell you why I think changing the way tobacco is sold in Minneapolis is so important. If you decide to take menthol flavored tobacco out of stores that kids visit every day, I know fewer kids will start using products and become addicted. This will make our community healthier today and in the future. Thank you.
Thank you very much. Is Stephen Marsh here? And then after Stephen will be Daryl Pratt.
Hi, my name's Steve Marsh. I live on 722 Monroe in Northeast. I tried cigarettes for the first time on my grandpa's farm when I was 12 years old. They were not menthol, but I do smoke Newports today. The statistics are clear. Oppressed and marginalized groups of all colors and poor white people smoke cigarettes much more than groups who are doing better financially. It reminds me of Henry Rollins' recent quote, "America's real safety net is drugs, alcohol, cheap food, and free porn." Star Tribune wrote recently that tobacco groups descended, that pro-tobacco lobby descended on City Hall in response to this ordinance, but the anti-tobacco lobbyists and the healthcare lobbyists were already here. They're the ones who wrote it. The people wearing these minty green T-shirts were given to them by the Minnesota Association for Non-Smokers, which was funded by a $150,000 grant by Clearway, Minnesota. And I just think that the anti-tobacco lobby's dirty secret is that menthol tobacco isn't the reason marginalized groups and poor white people are struggling. It's a symptom. Many of us are facing real barriers to doing better in this city. And if the anti-gun lobby or the pro-education lobby or the criminal justice reform lobby had this kind of funding to hire expensive lobbyists who could pass out free T-shirts, maybe they could help set the council's agenda. Eventually, the disadvantaged classes of today could trade up to slightly healthier, yet more socially acceptable vices like drinking scotch or frequenting French restaurants or spending too much money on yoga classes. And I'd just like to ask, when has prohibition ever worked?
Thank you very much. And then Daryl, followed by Abraham Awaji. Welcome.
Good afternoon. My name is Darrell Pratt, and I live in Ward 8. I'm here today asking you for, I live in Ward 8. I'm here today in support of the new ordinance and asking you guys to support. I've lived in Minneapolis my entire life, and I grew up and gone to school in Minneapolis. I've also have experience in going to school in other suburbs of Minneapolis, and the reason that I bring that up to you today is the fact that I've noticed that as a youth, the difference in how menthol and tobacco products are being advertised and marketed in my city compared to the cities I would go to school in. The reason I bring this up to you is that I remember as a kid coming home from the gas station, convenience store in my neighborhood, and walking home and asking my mom about Newports. This is I was a child when I brought this up to her, and I got in trouble, of course. And the reason I brought this up to her is because I had noticed that every convenience store and gas station in my neighborhood had the same poster on their front door. And that poster was a picture of a huge package of Newport cigarettes. The reason I bring this up to you today is because I've experienced firsthand on how this creates a negative social norm amongst youth. This has led to many of my friends and peers to pick up cigarettes as early as middle school and becoming addicted to these cigarettes by the time we graduated high school. This is why today I ask you to support the ordinance and creating a better smoke-free environment for our youth. Thank you today.
Thank you very much. And then our next speaker will be Raymond Boyce.
Good afternoon. My name is Abraham Awajan, and I oppose this ordinance. I'd just like to say, is it the government job to stop legal adults from making unhealthy choices? Can they require that you eat enough vegetable, or can they stop you from eating too much chocolate chip cookies? Is it too right for the government to restrict the freedom of adults over 18 from buying cigarette, menthol, anywhere? Whose body is it anyway? The political left has long defended abortion right with slogans such as "our bodies, our choice, our rights." This bodily autonomy should also apply to other life choices, such as smoking menthol and purchasing it in the convenience store legally. A smoker, I am a smoker. Smoking is a terrible idea. It's foolish. But as an American, I respect and defend every adult right to make decisions for themselves. Every adult has their own life to live. Not government, regulators, not officials should be telling them otherwise. And I do oppose this ordinance strongly. Thank you.
Thank you very much. Raymond Boyce, followed by Sadie Lindquist.
Chair Gordon and council members, my name is Raymond Boyle. I represent Ward 1 on the Minneapolis Public Health Advisory Committee. I live at 2331 Roosevelt Street in Northeast Minneapolis. I've lived Northeast for 23 years. My spouse is a Minneapolis public school teacher, and we raised our kids in this great city. Professionally, I have a PhD in public health. I direct the Minnesota Adult Tobacco Survey, and I lead the research department at Clearway, Minnesota. Today, I'm speaking on behalf of the Minneapolis Public Health Advisory Committee, and specifically, I want to direct you to our letter of support from that committee. As you know, the committee consists of Minneapolis residents from every city ward and other key representatives. I want to highlight that all 20 members of the committee have endorsed this letter of support. We're asking the City Council to vote in favor of public health by adopting the restriction on the sale of flavored tobacco products to tobacco-only shops. You'll note in our letter that we highlight the strong evidence-based rationale for restricting the sale of menthol tobacco. The research is quite clear. It makes it easier to start. It appeals to young people and is disproportionately marketed to communities of color. I personally think the change in the tobacco ordinance is a perfect example of strong public policy that will enhance public health. It's also important to realize we're not alone. Restricting menthol has been endorsed by the American Public Health Association, the American Academy of Pediatrics, and many other national and local health experts. So, in closing, it is the unanimous position of the Public Health Advisory Committee that you should approve this proposal, and this will make our city an even better place to live. Thank you very much.
Thank you, Mr. Boyle. Is Sadie Lundquist here? And then Sophia Hernandez can get ready to speak next. Good afternoon.
Hi, my name is Sadie Lundquist, and I am a Minneapolis resident from Ward 10. I'm also the coalition coordinator for the Southside Urban Coalition. The coalition is a group of organizations in the community that works to prevent youth substance abuse in South Minneapolis. We host a program that's called the Southside Ambassador Youth, where we have about 20 South Minneapolis youths who are active in our program. And through this program, we've really seen how tobacco is affecting our community. We did a survey, an informal survey with approximately 20 students who were present, and we found that the majority of them live in homes with parents who smoke, and about 3/4 of them also have asthma. So we are trying to make an impact on youth tobacco use and prevent kids in our project area from becoming smokers. But we can only do so much, and right now you can do more than we ever can. I encourage you to support this ordinance to ensure the youth in our community don't have to suffer from a lifetime of disease and addiction. Thank you.
Thank you very much. Sophia Hernandez, followed by Suzanne Nash.
Hi, my name is Sophia Hernandez, and I'm here to speak against I'm here for the policy, and I feel like prohibiting where menthol and commercial tobacco is being sold would help because it gives our youth within the community a fighting chance to live a commercial tobacco-free lifestyle. This policy will give our youth less access and will make it harder for people in general to have access to tobacco. Only selling tobacco in tobacco shops might bring our numbers down, which include like our health risks and stuff like that. And I feel like that's an important thing because this city, they need the people, you know, and what are we going to do if half our people are half dead because of lung cancer and stuff like that? So, which is more important, the city of Minneapolis or the sales tax that we benefit off of it?
Thank you very much. Suzanne Nash, followed by Jean. Maybe.
Good afternoon. Bonjour, Niansen, Disikas Magazine, Dotum. My Western name is Suzanne Nash, and I'm here representing the American Indian community. I'm a boy sport band member of Ojibwe. And I had a script, and listening to all the different testimonies today, I just want to say that since in history, tobacco was meant for prayer. It wasn't intended to be commercial tobacco, to be colonized with the ingredients of formaldehyde, sugar, bleach, and we can go on. When it's intended and abused in that way, it becomes deadly, becomes sick. If it weren't colonized and it weren't processed and altered from traditional tobacco to commercial tobacco, we wouldn't be here today fighting for the next generation that comes before us. So, you know, I want to speak from the heart and say that as a mother, I lost my father-in-law to COPD, who also was a veterinarian, to my son who has asthma. I just want you all to know that do what's right for the next generation and think from your hearts, not around politics, not around the law. Think from in here, because it's the next generation that we need to be worried about. Miigwech.
Thank you very much. And now it's Jean, and I can't, Lee, help me with your last name.
Yes, my name is Jeannie Weigum, and I'm the president of the Association for Non-Smokers Minnesota. When we take a position on something, we try to have some evidence to support it, and we did some research. We researched documents from the convenience store industry and learned some very interesting things. The industry would have you believe that the sky and their profits will fall catastrophically should this ordinance be passed. Their own documents tell a very different story. While all tobacco sales make up 36% of in-store sales, it makes only 17% of profits. You've heard many people here today talk about sales. Nobody mentioned profits. Profits, 17%. And that's all tobacco products. The average in Minnesota is 25% of the tobacco sold is menthol. So we're talking 25% of 17%. And suddenly the numbers look rather different. Instead of the multi-millions of dollars you've heard the industry talk about, their own numbers suggest about $1,500 per store per month. That is important. Those are real numbers, and we care about them, but they're not catastrophic. The tobacco industry also claims that when they can't sell a particular tobacco product, they also won't sell other products in their stores. We researched that too from their own documents, and we discovered that 49% of people who go to convenience stores go to buy a beverage. 35% go to purchase food or a snack, and 17% go to purchase other things, including tobacco. Tobacco isn't even in the top 3. In other words, people go to convenience stores for a whole lot other than tobacco. In March, we surveyed 100 adult smokers in Minneapolis and St. Paul who used menthol products. We asked them if they would continue to go to convenience stores. 93% yes. 93%. They have loyal customers. They will continue to go. Thank you very much.
Thank you very much. Next is Dai Vu, followed by Mitchell Davis.
Good afternoon, council members. My name is Daivu, and I live at 5536 32nd Avenue South in Ward 11. As someone who works in cancer prevention, I fully support this ordinance. It will stop youth from becoming addicted to tobacco. There are many Somali, Latino, Asian, and Native American youth living in my neighborhood that have too easy access to menthol tobacco. Menthol makes it easier for them to start smoking and contribute to the health disparities we see in Minneapolis. Menthol also makes it harder for people to quit smoking. In my work, I talk to a lot of smokers. Almost all of them have told me they want to stop and wish they had never started. This ordinance will help prevent young people from ever starting and never having to face the difficulty of trying to quit or the health consequences of tobacco use. I hope that you will all vote yes. Thank you.
Thank you very much.
Good afternoon.
Good afternoon.
City Council. My name is Mitchell Davis. I'm a researcher. I live in North Minneapolis, 2810 18th Avenue North in Minneapolis. I'm also a consultant, also the pastoral staff of the New Life Seventh-day Adventist Church. I've held positions at the Minneapolis Urban League, teaching the tobacco cessation program that Hennepin County endorses. Also, I've served as the University of Minnesota Health Disparities Community Health Advisory Council chairperson, and also as a director for the Minnesota Department of Health Office of Minority and Multicultural Health. Today, I'm here to support this proposal. I've seen how menthol tobacco affects Black Minnesotans, not just in my work, but also as a Black male as well. Historically, smoking has had a special resonance in the Black community. Brown and Williamson started advertising Cools back in 1960, using African-American models and language that reflected the Black experience. It quickly became the most popular brand for African-Americans at that time. Since then, tobacco companies still flood our community with messages promoting menthol cigarettes. You see, they adapt to the changing times. When funk was big, they'd make their ads funky. When hip hop took over, they made the tobacco advertisements hip hop. They keep their finger on the pulse beat so they can reach our Black youth just like they're doing today. So keeping menthol out of the stores will help keep our young people, our children, and our youth who have always been the big tobacco's real targets. By passing this policy, you will help snatch our youth and our children from the jaws of big tobacco. By passing this policy, help our children and youth grow up healthy and strong in our Minneapolis communities. I thank you.
Thank you very much. Next is Margaret Reinhardt, followed by Titilao Vendiki. Either of them here? Students from the We Win Institute and the Minneapolis Youth Congress are also signed up. Okay, maybe if you can hear this, you can come back in here, and we'll see if Casey. Yes. Pardon me? Well, who's ever here is welcome to come and speak. I think We Win was first on the list. Councilmember Bender, did you want to say something?
Thank you, Mr. Chair. I just wanted to check in because I know we were potentially having an issue with our quorum of our committee, and while the public hearing and testimony is very important, I also just wanted to check and make sure that we're going to be able to take action today and kind of leave it up maybe to folks who've come to speak if they want to choose between us hearing the rest of the hearing and being able to take action or not. I'm able to stay for as long as we need, but just wanted to check in just because you made that statement at the beginning of the committee.
Yes, we still have roughly 30 people. It looks like a little bit less who requested the opportunity to speak. So it'd be nice to give them the opportunity. I do know that we have council members who feel like they have to leave for other engagements. So maybe people can be aware of that and try to keep your comments as brief as possible, and maybe we can get through this as quickly as we can so we can take action on it. Go ahead.
Hi, my name is Cassie Jarrett. I'm the Health Committee Coordinator for the Minneapolis Youth Congress.
and I'm here on behalf of my organization to send a letter to you guys. Dear Minneapolis City Council, the Minneapolis Youth Congress, whose motto is "No decision about us without us," supports amending the tobacco sale ordinance to remove the menthol flavored tobacco exemption so that menthol tobacco products are restricted to adult-only tobacco shops. The Minneapolis Youth Congress has discussed this issue at multiple meetings, and many members shared that menthol products are popular among youth. MIC members feel that youth are able to easily access these products by purchasing directly at the store. In 2015, the Minneapolis Youth Congress made recommendations directly to you guys to restrict the sale of flavored tobacco products to tobacco-only shops, which would limit the age at which tobacco flavored is sold. Based on our surveys and focused conversations with the youth at the community, the MIC believes restricting access is an important strategy to prevent youth from starting tobacco and eventually becoming a lifelong user. The 2015 ordinance change, while an important first step, left out menthol flavoring, which is a widely appealing flavor for youth. In our 2014 youth survey, when asked if the cigarettes they usually smoke are menthol, 51% said they are. Based on this data, it's clear that menthol is an important first step to creating lifelong users. The Minneapolis Youth Congress is heavily invested in this issue and asked you to remove the menthol exemption to better protect the youth of Minneapolis of all backgrounds from tobacco targeting and lifelong health issues associated with being tobacco users. Thank you.
Thank you very much. Next, I don't know which, yes, whoever is ready. Introduce yourself. Welcome.
Hello, I'm Titi Layo Bidiaco, Executive Director of We Win Institute. Our mission is the academic and social success of all children, which includes their health. I live in the 9th Ward. Alexandre is my council member. And I could repeat things that have been said over and over again, but I want to just focus on one thing that We Win is doing. We're using some of the tobacco companies' tactics. We're working with our children and we're educating them in terms of the dangers of tobacco. I was a smoker once, and what did I smoke? Menthol. And it was the hardest thing that I ever did in terms of quitting, because I want you to know something. It wasn't that I kept enjoying it. I was just so addicted, and it was very, very difficult. And what I'm saying to you is that we already know that the majority of smokers in the African American community smoke menthol. And I want you to know, when I was young and I was smoking, if they weren't selling cigarettes at corner stores, I never would have had access to it. It would have been too hard. And the only thing that I have to say to store owners is that let's lose a little profit if there's much being gotten in terms of the health of our children. And next, some of our children are going to come and testify to you in terms of explaining what they've learned in terms of the dangers of tobacco and menthol. Please support this ordinance.
My name is Ray Shannon, and we participate in We Win's Women of Distinction program. We've done a lot of research and learned a lot about menthol tobacco harm in our community over the past 2 years. As a part of our project on menthol, we completed surveys on our peers on tobacco. During January, February, and March, we surveyed a total of 200 kids, 10 to 18, who lived in Minneapolis. The survey showed that 60% of those students who think that tobacco is a problem in their community, but 21% said it wasn't. Thankfully, most of the students said they hadn't tried tobacco, but 28% have. And I think that is too many. Of the people we surveyed, 83 of those who tried tobacco used it for the first time when they were between 8 and 13.
Hi, my name is Nisa Gumbiade. And while we were working on these surveys, people told us a story about how tobacco affects their lives. And I'm going to tell you a couple. One boy, he started crying and breaking down because his grandfather, who he was really close to, passed away from smoking-related illnesses. And another boy said he smokes, and when he was done, he asked if he had to put his name on the survey. I told him that he didn't have to, and later realized why he didn't want to. He didn't want to because he was ashamed of smoking, as most smokers are.
My name is Louise Miller, and I am part of We Win Institute, Rites of Passage, and I know many people who smoke, and it lets me know that their health is hurt by tobacco. And it also makes me angry that tobacco campaigns is targeting African American people. So please help me, my friends, and family stay away from the bad effects of tobacco.
So we're probably going to lose our quorum in about 9 minutes. There's at least, it looks like about 17 people who want to speak in favor of the ordinance left and 6 who are opposed. I'd like to take as many comments as we can till then, unless the committee feels like we need to delay to get all the comments. I also don't want to cut anybody off who necessarily wants to speak. Maybe I could get a show of hands with that information in mind. Is there somebody, and also think about what's already been stated, what's already been covered, and what hasn't been covered. Is there somebody who really feels the need that they want to add something new and to speak to this issue? Raise your hand. And I don't know who's in the other room, but I see, Natalie, with your hand up? 1, 2, 3, 4, 5, 6, 7, 8 hands. 9, 6, well, if you've already spoken, definitely don't raise your hand to speak again. Because, well, that's going to be, that's probably going to be a challenge. Pardon me? Well, there's a hand right there that wants to speak. How can I say no to that? So why don't we try to raise your hands again then, maybe if people aren't really done. All right, put your hands down. How many of those are against the proposal? 1, 2. Okay, why don't we take, you've already spoken against the proposal. I know that you've spoken, we've got you. Why don't we take 2 who are against and see if we can give them a couple minutes, and then we'll take the 2 remaining who are left, or if they need to, they can try to fit into the time. So did you want to speak opposed to this? No, behind you. Yes, why don't you speak? Try to keep it to 1 or 2 minutes, the shorter the better.
Okay, so dear Minneapolis City Council, in Free to Choose, Milton Friedman stated there's no place for government to prohibit consumers from buying products, the effect of which to be harm to themselves. When it comes to tobacco flavorings, should it extend to all Americans? Should it fairly restrict flavored and mentholated tobacco sales in all of Minnesota? Should we find it necessary to dictate a consumer's choice? Does not health and wellness begin at home? Do the lobbyists and tax-free religious organizations strongly influence the Minneapolis City Council's maintenance cloak of public welfare without considering the people? It is still not clear if specific tobacco flavoring sales bans would actually be successful in decreasing tobacco purchases and eliminating healthcare disparities overall. Chicago, the first city to ban mentholated products, has already retracted many restrictions. If we attempt to further encourage healthier lifestyles, then we cannot further an ever-looming problem of neighborhood blight and crime in minority and majority neighborhoods. Reducing consumption of tobacco is a laudable goal, given their likely impact on the state's health. Yet there is no need to single out specific populations. All Americans should consume less tobacco products of any flavor if we want to constructively impact health outcomes. Our small retail businesses are important and should not be attacked for providing a good. More importantly, a broad-based educational campaign would prove more effective, or even switching to a sugar ban or caffeine ban. As neighborhood businesses continue to be further restricted in sales in Minneapolis residents suffer, and the likelihood of a black market is certain. Will the ban prevent people from consuming mentholated tobacco products? No. They will commute elsewhere. Often these very stores offer a multitude of convenience services for the very specific populations the ban wishes to target. Many businesses and franchises refrain from doing businesses in my backyard due to the demographics.
So that's 2 minutes. If you have written comments, you can hand them in. If you did miss the public hearing so far, you probably didn't hear that a lot of these things were covered. So But I appreciate that. And
That's great. I still want
I
to
appreciate
state
you
my-
had your 2 minutes, and I'm glad that you came here to speak.
Thank you.
So last but not least, from the opposed side, would you like to introduce yourself and try to keep it to a minute?
I'm Clay Lambert. I own Metro Petro by University. I'm in Cam Gordon's district. I'm going to talk about the financial aspect here for all of us here in the industry, and also the industry as a whole, as a tobacco industry. We just got a note from Wells Fargo that their assessment of this is it's a no factor for the manufacturers. Legal sales will continue. Sales will migrate to another city, and then other retailers will pick up the sales elsewhere, not in Minneapolis, and that's their opinion. So they have a buy rating on their stock. That doesn't help us out at all. And where we're at, we feel, my wife and I think everybody in this room, is there's some business loss here that needs to be compensated for if we're going to go through with this. I started this business without seeing this coming at all. And I know business is tough and this, that, and the other, and I chose this business, but a legal product being banned from the state government is just nothing you can prepare for. And if the government comes in and builds a new highway, they compensate the business or the homeowner or something like that. If you go this direction, I think we would like some compensation for this loss to maintain.
Okay, thank you very much.
And I got 38 seconds, right?
Uh-huh.
Okay. So it's that, Cam. I can't adjust that fast. I know you've heard that also. We're not opposed to this. It's just you guys got to slow this down a lot. And that's going to be our message right now. You guys are winning. It is slowing down, even though everybody's saying it's not. It is slowing down. I see it. I'm the guy that sells it. That's what you're trying to prevent. And it is slowing down, and we're making that adjustment, but slowly. You're going to see contributions to the neighborhood. I can't afford that anymore. My membership associations, 0. So it affects a lot of other things. Thanks for your time.
Okay, appreciate that. Now, there's some last closing comments from the supporter side, or are we? One more comment.
My name is Sunny. My last name is Chantanawong, Executive Director of Law Assistance in Minnesota. On behalf of the Southeast Asians, we love smoking. The smoking is in our blood. And today we are coming to talk about important things. The decision making today is for our generations. I'm very concerned about my community health. I'm concerned about that. I have daughter, I have teenage. If we don't have a law, if we don't have policy in my house, she will break it. So today, I rely on your leadership to make decisions that will affect our community. So this is what I wish. I'm not politics. This is my first time to testify. Live in here for 35 years. Today is my first day. I see that this is a very important bill. On behalf of our community, come in here, live in that room. They are very support. I would like to thank you for your support. This ordinance. Thank you.
Thank you so much for coming to speak. Councilmember Bender, I was thinking of closing the public hearing.
Okay. I'm also happy to stay if you want to. I think we're literally losing a council member. Okay. I was going to move the item so that we could maybe leave the hearing open, and I would have been happy to stay with you to hear the rest. I'm not sure we can.
All right. So we've lost our quorum. So we can continue. We've got a couple options here. We can continue to take our testimony, but we're not going to be able to vote on it today. So does anybody want to keep speaking? Yep. Oh yeah, I'm prepared to stay here until every person who wants to speak. Everyone's welcome to leave whenever they want, though.
Could you just explain to us what exactly happened? So if you walked away, what does that mean?
I like to speak.
Well, sit down for a minute, all right? I'm just going to make it clear. Yeah. So as I said at the beginning, and as we stopped to talk about a couple of times, we didn't have a full quorum of the committee is 4 committee members. We had quorum. We were concerned about quorum, and we tried to So what happens is sometimes council members get busy schedules and they make other appointments. I think our assumption is that people weren't here because they had some legitimate reason. Councilmember Bender explained to me early on, weeks ago, that she had a doctor's appointment and she'd have to leave early. Councilmember Fry, I learned this morning, had some kind of conflict on his calendar. I heard at about 3:20 that Councilmember Cano also had an appointment. Councilmember Johnson, I know, also has a 4 o'clock scheduled. So people were warning me about it. Generally, I want the public hearing to go as long as possible. Generally, I like to give 3 minutes to everybody to speak. We had a big list of people, so we shortened it. Right now, the public hearing is still open. We can keep our committee going and take all the testimony that we want, but we are prohibited by our rules of taking any action without a quorum. So all we can do is then, I believe I could take the action to at least close the public hearing as chair, but then we'll adjourn this meeting and we'll either take up this matter at a special meeting, at committee of the whole, or at our next committee meeting where we'll take a vote on it. And unfortunately, those council members who were missing didn't have the advantage of the public hearing, but they'll be able to watch it on video. So with all that said, why don't we see if we can let a few more people who haven't spoken. You've spoken. Well, you go whisper to the clerk. She can answer it for you. Go whisper take it to the clerk then. She can answer questions on the side. And we're going to let Natalie come up and speak, and then you can speak, gentlemen. And if you want to speak, you can maybe get in line, and we'll have an opportunity to take the rest of the testimony that Councilmember Bender and I will hear.
Good evening, good afternoon or evening, committee chairs and fellow colleagues.
I tried to say you heard it. Yeah. All right. Sorry. Councilmember Johnson's going to have to leave to a meeting in the ward.
Former Councilmember Natalie Johnson Lee. I will say to you that was a very cowardly move, and I will tell her to her face because she could have saved a couple of more minutes, and I'll make sure she understands it. But let me just say this to you. Actually, 13 years, almost to the date, the city of Minneapolis, me sitting behind that chair, made a courageous vote, and that vote was to ban smoking in restaurants and bars. The reason why I know how this goes is because I sat there and we listened to many, many hours of testimony from concerned citizens on both sides. As a council member, when you know those issues are coming up, you change your priorities to listen to the citizens that voted you into office. That's what you do. So what I'm saying here today, there was several people that said, it's not a statewide ban. Well, neither was the smoking ban. And then 2 years later, it was statewide. I'm going to say here today, I support this amendment. I'm very frustrated and unnerved that we've turned it into a racial issue when it's about the health of our youth and the health of young people across the city of Minneapolis. Many of the people that you talk that are opposed it are owners, but so were the restaurants. They were business owners, and they had some of the same complaints that I hear right now. But our restaurants and our businesses are thriving downtown. They're thriving in local communities, and people are still going, and business hasn't stopped. So I urge you to look at your history. I urge you to think about the young people and not make this a race issue, but make it a health issue and do and make the right vote. Thank you.
Why don't you introduce yourself and tell us what's on your mind?
Good afternoon, City Council members. My name is Liziah Smith. I live on the north side of Minneapolis. I am speaking on the behalf of every child that couldn't be here right now. I think that you should put menthol tobacco in adult stores only so children cannot access it. Children are the key to the future. Children are the future. Menthol tobacco is bad to your health. Menthol tobacco is addictive too. I know that you would do the right thing to help children just like me. Thank you.
Thank you. Is there anybody else who hasn't spoken? Yes, you can come up and get in line, but if you've already spoken, I don't want you to speak again, but you can ask any question to the clerk.
I'm actually, I got a request to keep the public.
You can ask the question to the clerk. I'm not going to, so come up and speak.
Good afternoon.
My name is Jamari Jordan Onchiri. I am 17 years old. I have been in the Minneapolis Youth Congress for the last 5 years. I was a part of the effort to pass the first ordinance, and now I am back to get this one passed. My grandmother used to smoke a pack of Newport menthol cigarettes a day. Her smoking attributed greatly to my asthma. Almost all of my grandmother's children smoke Newport cigarettes and have tried multiple times to quit without any success. I am a high school student and see a great deal of my peers smoking cigarettes. The menthol exemption concerns me for many reasons, among them being that I have 4 younger siblings, and I want them to have the opportunity to live a cigarette-free life, and I believe the first step is to make tobacco products, especially the flavored products, less accessible to underage youth. Thank you for your consideration to this policy.
Thank you very much. Why don't you introduce yourself?
Good afternoon. My name is Sharon Record. I am 17 years old and I have been a part of the Minneapolis Youth Congress for 2 or 3 years now. And I am here with another member, as you have seen, on behalf of the other Youth Congress members. I grew up in a household where my aunt and my mom smoked menthol products. They've claimed it helps with their nerves, but I know it was a bad habit that they picked up from growing up around it. This problem does not stop at my home, though. I see it in my community with my peers at my high school, on the streets, downtown, where many people go each day. Some either the same age as I am, older, or even younger than I am. In my experience, many menthol companies tend to set their products in neighborhoods with the poor, underserved populations because they know that our people are the ones who will give them the most profit. My mom is one of those who were targeted. With menthol products that affects the underserved populations, they could even get to generations after us. Growing up around this bad habit with my other 5 siblings, it rubbed off on them as well. I understand the companies need their profit, but that doesn't mean that their product should be everywhere possible, being accessed by even teenagers that I know. The health problems that come along with smoking them is very dangerous, as we all know. I'm not sure if that means anything to you, but it means a lot to me and other families who may have lost someone to the outcomes of this product. I'm asking you to make menthol tobacco less accessible in our community, not only for me, but for generations after myself. Thank you for your time.
Thank you very much.
Good afternoon.
Good afternoon. Thanks for being here.
Yes.
Could you introduce yourself for the record, please?
Yes. My name is Patricia Vito. There's this picture of the second half of our group out in the hallway earlier. I just brought that to show the council. They were sitting in the overflow room and they wanted to be seen. So they were here earlier when the room was jam-packed. So as I said, my name's Patricia Vito. I work at North Point Health and Wellness Center in North Minneapolis, and I passionately support restricting the sale of menthol tobacco products to adult tobacco shops in our city. You may be familiar with my face as I helped to lead the efforts in 2015 to restrict the sale of sweet candy-flavored tobacco products to adult-only shops. While I was proud of the unanimous vote to support the measure, I told you at that time that I'd be back. Here I am with 2 large groups, right? One in the hallway, one in the room. Menthol is not just another flavor. It is the flavor for the tobacco industry's bottom line. Menthol use among certain populations is inexcusably high. The use of menthol among high school students has doubled since 2000, and 88% of African American smokers use menthol. Make no mistake that this is not a convenient accident for an industry that spends billions of dollars marketing their products. The tobacco industry has long manipulated levels of menthol in their cigarettes, making it much easier to pick up smoking and much harder to quit. To them, each new smoker and each current smoker who can't quit means dollar signs. Profits over people should be the tobacco industry's official motto. Do what you want to know just how important sales of menthol tobacco are to the tobacco industry. Twice in the past few months, they have flown national African American leaders in, including the Reverend Al Sharpton, to our community to try to defeat our efforts. The message these men bring with them all on the dime of Reynolds America, makers of the most popular menthol cigarette Newport, is that what the city of Minneapolis is proposing is a ban on menthol tobacco. They go on radio shows and talk to Black churches trying to raise fears that this ordinance will criminalize mostly Black men. They argue that the proposal amounts to prohibition and will lead to harassment of menthol smokers. You and I know full well that this is an outright lie. But when the industry sends in Al Sharpton, people listen. So if you are listening to me now, let me be clear, Minneapolis is not considering a ban on menthol tobacco at all. There is no criminal penalty for menthol use. I urge you to please vote in favor of this ordinance. Thank you.
Thank you very much. I don't see anybody else who's come. Oh, did you want to speak, ma'am? So you haven't had a turn yet. And I'm going to take all the testimony I can today, and then I'll close the public hearing. We're not going to have a public hearing that will stay open. Yes, ma'am.
HOTAP Chair Gordon, and thank you, Mr. Bender, for remaining, and to the remainder of the committee members in their absence. I am Neora Hoax, and I live in Ward 5 at 1350 Russell Avenue North. I am here as a proud grandparent. You heard the testimony of my granddaughter, Lazaya, and an alumna of the LAMP Leadership Institute. LAMP leaders work to reduce tobacco use and improve health equity for diverse communities in Minnesota. I support and say Asante Sana to each of you for considering limiting where menthol tobacco products can be sold in Minneapolis. I feel strongly that this policy will go a long way in ensuring young people in my community do not get hooked on menthol tobacco. Despite what some may argue, this policy is not discriminatory toward African Americans. In fact, it is the tobacco industry that has racially targeted African Americans for decades. Because of this targeting, the industry has benefited handsomely at the expense of African American lungs. An executive of R.J. Reynolds said, and I quote, "We don't smoke that S blank, blank, blank. We just sell it. We reserve the right to smoke for the young, the poor, the Black, and stupid," end quote. This is a racist statement and clearly shows that our community has long been a target of the tobacco industry. Not doing so to curb the impact of tobacco has on our city could, in fact, be considered racist. Sitting on our hands means that our grandchildren will continue to be targeted by the tobacco industry. Our young people will replace their grandparents who are sick or dying from the lifelong addiction of menthol tobacco. You can stop this deadly cycle. This ordinance will make our community healthier today, tomorrow, and in the future. Health is wealth, and I consider thanking you for your advanced support of this ordinance. Thank you.
Thank you. So I'm not going to start taking second times. There's other people who want to speak second time. We can talk later. I'll stay and talk to you. No, sorry, you can talk to the clerk. And I believe I answered everybody publicly that we will not be extending the public hearing. We're going to close the public hearing right now today. So that's what I heard. So the public hearing should be still open, so we keep this conversation going for the next meeting. Just to let folks know, I'm closing the public hearing, but people can contact their council members, they can contact the mayor, they can write to the entire city council, so all the comments can still be collected till there's a decision. I'd like to adjourn this meeting to, can I adjourn it to a specific date? Is that what I should do? I'd like to do it to, adjourn it to 9. We can discuss this too with my committee members, but I'm looking at 9 or 9:15 on, let me get my calendar open, before committee of the whole on the 2nd. Is that right? Yeah, there's an election committee actually that's at 9:45. So what about 9 a.m. on August 2nd? And that's just what I'm going to declare. I'm not going to take a vote on that because that's just what I get to do as chair of the committee. And I really apologize to everybody that came, that we lost quorum. I guess I should own part of that responsibility, that I didn't point out to everybody what a long public hearing this was certain to be if you paid attention at all, and that people should have blocked off more of their day. Thank you.